Dietitian, here with Dr. Hashmi, who's a nephrologist, and we are doing a live Q&A. Put your questions in the question box, and we have 30 minutes today, so we're going to get to as many as we can. How are you doing today, Dr. Hashmi?
I'm well. Let's dive in because I know there's a lot of stuff.
Yes.
People are curious about.
Okay. So the first one that I see on here, it says, if vitamin C supplements are not recommended for people with kidney disease, how is its addition in fortified foods not viewed in the same way? So I guess it kind of depends on what it is. Yes, usually high dose vitamin C supplementation is not recommended for people with kidney disease. If you think of taking like a tablet of vitamin C, that's usually hundreds to thousands of milligrams of vitamin C, where if it's naturally in food, then you might, even if you got 100 milligrams or 200 milligrams, it's paired with fiber, antioxidants. It's usually spread out throughout the day. So as far as when it's added to a food, sometimes it's used as like helping preserve the food, but usually you're not seeing those amounts of vitamin C if it's added to a food. Anything to add to that, Dr. Hashmi?
Yeah, so look, it's really hard to get a deficiency in vitamin C. So that's number one. So you want to remember that. Number two is what we're worried about is vitamin C supplementation where the C will convert to oxalate. So that's the biggest risk factor we have because the oxalate will get absorbed in the body. When you get vitamin C in the form of food, the difference there is the absorption is not as rapid. And so as a result of it, you have a chance to reduce the risk overall for calcium oxalate precipitation inside the kidney. Once again, if you have calcium that you consume, the calcium will bind to the oxalate and will prevent that from going inside the body. When you're taking vitamin C and you're worried about the conversion to oxalate with food forms, you're actually going to have less oxalate by itself, and that's going to make it much easier.
All right. Next question. They said their Dipstick test says trace protein. The protein creatinine ratio is in the 400s, and the albumin creatinine is 159. What does it mean, and what can they do?
Okay, so so Dipstick, as you know, is a very simple test. It doesn't give you one way or the other. It'll give you things like trace 1 plus 2 plus 3 plus, etc. So forget about that. What you're really looking for is the protein to creatinine ratio, and that's going to give you the best clue. So if your protein to creatinine ratio is coming out to be 400, that's an opportunity to say, let's work on figuring out what's causing it. Is it your weight? Is it your blood pressure? Is it diabetes? Or is it some kind of a kidney disease or what we call a GN or glomerulonephritis? And for all of those reasons, you need to see your kidney doctor so that we can figure out whether it is as simple as correcting those things or we need to do a biopsy and get to the bottom of everything.
Yeah, and I guess a question that's a little bit down, but related to protein in the urine. Someone wants to know, Deborah said, can protein be removed from the urine? And maybe they mean decreased or...
Yeah, I don't know what that means to remove it, but remember, protein spills because there's increased glomerular pressure, so the protein is literally leaking through. And sometimes if there's enough damage, then you're just creating these spaces where protein starts to go more and more and more. So when you say, can it be removed? The idea is, can we reduce the pressure on the kidney? And the answer is absolutely. Simple things like ACE inhibitors, ARB. So those are medicines like the prils, benazepril, lisinopril, anything that ends with a pril or an ARB, losartan, telmisartan. All of those guys are going to be the ones that will reduce the pressure. Even aldosterone antagonists like spironolactone. We've talked about SGLT2 inhibitors such as empagliflozin, dapagliflozin. So those are all the options that you can reduce the pressure onto the kidney. But don't forget simple options. Simple options are the less salt you're eating, the less protein you're going to spill. The less weight you have, the less protein you're going to spill. The less blood pressure you have, the less protein you're going to spill. So diet matters. Salt in your diet matters. Sugar is going to cause you to spill more protein. The less sugar you have inside your blood, the less protein you're going to have spilling out there. So sugar matters, salt matters, weight matters, blood pressure matters. the same stuff that we always come back to, and don't get into the hype that there's some magical supplement that will come and fix everything. You will get 90% of the benefits from just these things we talked about.
Yeah. I got a question earlier, but someone was asking about a specific like kidney supplement that claims to reverse, kidney disease and cure it and stuff. But part of their like supplement they sell is a plant-based alkaline diet. So you have to be on the diet and then also the supplement. And maybe parts of the supplement help. Like I'm not saying it might not be for some people, but it's like the diet is such and lifestyle is such a big part of it. Um, and makes a big difference. So okay, another question. Is there an alternative to Farxia? The side effects of UTI and necrotizing fasciitis really
So, okay, what you want to understand about the SGLT2. So you're talking about Farxiga and other ones such as Jardiance or empagliflozin. So this is dapagliflozin is what we're talking about. This question from Casey. Is there an alternative? The answer is yes, there are alternatives, but the SGLT2s have so many benefits out there that when we talk about the idea of taking them, the risk of UTIs or necrotizing fasciitis is extremely low, extremely low, not zero though. And part of it is you want to make sure you're peeing regularly because the risk of urine infections is there. So if you think of what gets infected, you have a river or you have a pond. Pond where water sits or bacteria sits, bacteria will grow and it will lead to an infection. A stream or a river, meaning you go to the bathroom regularly and you pee. So, in other words, don't hold your pee, go to the bathroom every 3, 4 hours. You're going to find that your risk of UTIs goes down dramatically. Cotton underwear, don't wear tight fitting underwear, right? Let that space sort of air itself out and stay dry. These are just very basics to preventing urinary tract infection, which means you got to hydrate so you can make sure that you have that stream going on. When we look at what the recommended amount of water is, and I remember, Michelle, you and I, we covered this in one of the videos. I can't remember which one, but we had talked about what the national guidelines were on how much water you should be drinking. Nobody drinks that amount. So when we talk about, hey, at least drink a couple of liters a day, those are just basics, unless, of course, you have certain disorders where you can't. But really, everybody ought to be aiming for at least a couple of liters a day.
Yeah. And look at the color of your urine. I think that, I mean, that really tells if you have dark yellow, orangish, I mean, you don't want your pee to be that color. Okay, next question. With stage 3 kidney disease, could PTH raise to 120 to 150 if the plant diet is too low in calcium? Or with normal serum calcium, vitamin D, and phosphorus, does the elevated PTH indicate a low level of active vitamin D?
Yes, it does. So, in other words, when we talk about chronic kidney disease, and the first thing to note about chronic kidney disease, all the PTH recommendations in CKD stages are expert opinion. The only thing we know about is that when you're on dialysis, that's where we talk about the 150 all the way up to 450, 500. The reason we say that is because if you suppress the PTH too much, you get what we call adynamic or soft bone disease. If you get PTH too high, you get brittle bone disease. So the first step of PTH is you have to replace regular D3, D2 kind of thing, or what we call over the counter vitamin D or the sunshine stuff that we talk about. So that's the inactive form of what's known as the 25 hydroxy vitamin D. That 25 hydroxy is going to go to your kidneys and turn into the active form. And those are things like calcitriol. So we will give them calcitriol or the active form. So we're still giving them the inactive form, replacing that, and we're giving them the active form because they need inactive and active together to make sure that the active is adding up.
Perfect. And that actually then someone had a question later about the difference between vitamin D3 over the counter and the calcitriol.
Right.
And since we're on the topic of all this vitamin D, phosphorus, and that, I want to answer a question that came up about they said I stopped drinking milk because of diabetes, and now they're worried about the phosphates in the plant milks. How bad are phosphates? So, one of the things for that, so dairy milk is going to contain phosphorus naturally, and it's typically absorbed about 60 to 80%, the phosphorus that's present in that. And then plant-based milks, if they have phosphorus additives, which you would see on the ingredient list, it'd say like dicalcium phosphate or dipotassium phosphate, anything PHOS, that's a phosphorus additive, and that's absorbed, 90 to 100%. So those plant milks with phosphorus additives, you would want to avoid, because those can contribute to excessive phosphorus in the diet. But there's plenty of plant based milks that don't have phosphorus additives. So if it's just like oats blended with water, or almonds with water, or cashews with water, even if it has some other, like they fortified it with vitamin D and calcium, if you check the ingredient list and it doesn't have phosphorus additives, then that's a natural plant source of phosphorus. It's usually only absorbed about 50% or less. And plant milks are typically a larger portion of water compared to the actual like nut or grain. And so typically they're not high in phosphorus naturally. So I hope that answers that on phosphorus. Let's see what else. Can someone in their early 80s still be considered for a kidney transplant?
Excellent question. So here's the thing that you want to understand about transplants. There is no formal age cutoff, but every transplant center actually sort of sets an age limit. And they set it based on the fact that if you're older, and depending on what your condition is, how many comorbidities you have, what's your physical status. What you have to understand about transplant is in order for the transplanted kidney to survive, we're giving you a ton of immunosuppressives to be able to prevent rejection. That means the risk of infection and all sorts of other issues, including cardiovascular mortality, shoots up. So, if you look at the UNOS guidelines, you'll see that there's really no set age criteria, but it's a functional limit. And the surgeons at the transplant centers usually will say, 80 is around that mark where it starts to become a little bit tricky. In my career, I've seen people over the age of 80 get transplanted, but those few that were extremely in very healthy shape. And that's why it made sense to take that risk, because the last thing you want to do is get a transplant and the complication actually causes the person to die early.
Okay. Let's see. Okay, this person said they're 5 months pregnant, very healthy. They go to the gym daily. Glucose is great. Weight is great. Their 24-hour urine test came back, and the protein's at 328, and also have an elevated ALT. Any ideas?
Yeah,
Pregnancy.
it's not so remember, in pregnancy, the last thing we're going to do is start you on one of the medications that we talked about, like the ACEs, the ARBs, aldosterone antagonists. Those are all contraindicated in pregnancy. So what we do is we watch you, we do our best to get you through the pregnancy, try to make sure that the blood pressure is controlled, try not to gain too much weight. Remember, we do not do any weight loss in pregnancy. We try to limit the weight gain in pregnancy. Make sure that your diet is more plant based and it's less processed foods, because the salts and the sugars are going to drive more protein through it. So, all of these things are important. And you want to make sure that you're one working with your OB very, very closely, because the OB will talk to the nephrologist. We work very closely with our OB colleagues and make sure that we're there every step of the way to get the person through a successful pregnancy. So we try not to go for any particular medications because of the fact that during that time, we don't want to risk anything major.
Yeah. All right. This person said they're watching from Japan, and they said good morning, because it's nighttime here for us. So good morning, and thanks for watching all the way in Japan. It's Ramadan right now, and their question is for kidney disease stage 3, can they fast during this time?
Yeah, so excellent question, right? You guys might have seen the latest study that's out that's making a bunch of waves right now about the idea that intermittent fasting actually increased the cardiovascular mortality. And we'll definitely, talk about that when the full study comes out. Right now, the full study hasn't even come out. And Bloomberg and all these major Washington Post and a few others have already like put out the headlines that intermittent fasting increases cardiovascular death. No, it doesn't. People have fasted throughout the entire civilization. And it's very important to look at the data behind that. Number two, in CKD, can you fast? The answer is absolutely yes, you can, with caveats. So, what are those caveats? For example, if you're somebody who's on diuretics and now you're going to be fasting, that can put you in a situation where you might pee out too much, you might make your blood pressure too low, you might affect your kidneys. So, remember, even in Ramadan and in every religion that has fasting, there's always the exceptions for health if you're unable to do it. For example, in the Islamic culture, you can give zakat in places where you can't fast. So don't feel like you have to do it. But if you're on certain medications that can cause your blood pressure to drop, and when you've done it in the past, you've seen that happen, or if you're fasting now, you've seen that happen, then don't do it. It's hard for me to give personalized advice because that's something we can't do on any sort of social media. But even then, talk to your nephrologist and ask them, these are my medications. Are there any diuretics? Are there any blood pressure medications that I need to be aware of? Make sure that you make this a joint decision and don't just fast if your blood pressure is dropping, if you're feeling dizzy. If those things are happening, then that is not the right thing to do.
All right. And I might say this wrong, cephalexin 500 milligrams safe for CKD stage 3.
Yeah, so cephalexin is Keflex. Keflex has been around forever. We use it a lot as far as that goes. And in terms of usage wise, yeah, 500 milligrams is the standard dose, as you are probably aware. So the answer is yes, you can definitely use it, especially if your doctor has prescribed it for you. But here's the catch. The catch is a lot of our patients don't complete the full treatment. Now, why does this matter? Is because if we give you a treatment dose that's for 3 days for UTI, for example, simple, straightforward UTI, person takes it for 1 day and they stop. What happens is when you first take an antibiotic, the bacteria that are very easy to kill, they die first. And then as you keep taking it, the ones that are harder to kill die later. So if you end up stopping the medication early, you have now left essentially the strongest bacteria around, the ones that might be drug resistant. And this is why one of the scariest things in the world is the fact that we have all of this emerging drug resistance. So please, if you're going to start an antibiotic, talk to your provider. You say, look, I don't want to do it. Okay, fine, we get it. But if you're going to do it, please make sure you finish. Otherwise, you're going to set yourself up to have more resistant bugs in the future.
Yeah. And let's see. Someone's saying hi, Carolyn. Hi from Arizona. And they appreciate all the well-researched data you provide. Thank you for that. Let's see. Okay, someone says the pain from peripheral neuropathy in their feet, a kidney biopsy showed membranous nephropathy. Their ratio numbers are mid 500s, GFR in the 90s, and active no diabetes. Sorry, I guess there wasn't a question on that one. Oh, they said, how can they lessen the pain? That was their question for that. So the pain from the neuropathy.
Neuropathy, and I'm trying to find that question, so I apologize. There's so many questions that I don't know where that question is. But if you're asking specifically about neuropathy, first, there's all sorts of new treatments out that can help you, and they're okay in chronic kidney disease. It's not like the old days, where in the old days we just had literally gabapentin, and that's all we had. Now we have a lot more treatments. So if you haven't seen your doctor, please do so. There's a number of new treatments. None of them are going to be perfect. But from where we started to where we're at now, we've made a tremendous amount of progress. So please follow up with your doctor. Definitely talk about it. And more importantly, the question is, why do you have neuropathy? Why? Is it because of diabetes? Right? That's the most common thing for bilateral neuropathy going on. Is it because, there's some kind of a blockage or narrowing or stenosis that's causing you to have it, or something else? So it's important to figure out why you have neuropathy and to realize there are options for it.
All right. Thank you for that. Someone said, okay, I've had a total left kidney removal. The right kidney is now at a 45 GFR. What can I eat to what can I eat to keep healthy? I'm so worried. I'd say, Donna, I mean, that we're happy you're here because our whole channel is dedicated to helping people learn what they can eat, what they can do lifestyle wise, in order to help protect their kidney function. So if you're new here, welcome, and check out, we have different playlists all on, like, I think we have like 70 videos just on diet and kidney disease. So please check that out. But I, I guess I'll kind of just say a few brief things is when we want to make sure we've talked a little bit about this, but usually it's low sodium diet, typically a lower protein, more plant protein that are minimally processed over animal protein, keeping added sugar out. If you have high blood sugar or diabetes, then you're controlling blood sugar, controlling blood pressure, being active, sleeping well, lower stress. I know these are just like briefly touching on the points of it, but those are some of the important things that we talk about in each and every one of our videos and then dive deeply into. But just know there's hope because there's a lot you can do, especially in stage 3 kidney disease to prevent that progression.
Michele, I have to tell you, there's like the best comment ever. This is from Too Old for blah, 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 but it says, I'm confused. The person normally on the right is now on the left. We're so
That's,
sorry. We just ruined everything today because, yes, we switched places.
well,
I
that's
don't
because I think usually you join first and I joined first this time. So I think that's why we're switched.
understood, understood.
Oh, okay, okay. Now I'm scrolling through. One question we got ahead of time, Dr. Hashmi, was just what's your opinion on kidney transplants, but with a pig kidney?
Yeah, I mean, I tell you, the best data on what is the closest thing to a real kidney is a kidney transplant. And the number of patients on the transplant list is so large that there are so many just absolutely incredible human beings who never get a chance to get off dialysis. And the dialysis risk of death, the mortality risk is still incredibly high. I haven't seen anything that's fundamentally changed the risk of dying on dialysis. And part of that is because when people are on it, it's tough because you're suffering, it's hard to make better choices. So it does make it so much harder. But when it comes to pig transplants, if that's available, the number of pigs that unfortunately are sacrificed right now just for meat is tremendous. And all those kidneys are wasted. There's all these kidneys that are available in terms of, the artificial kidney being the holy grail and all that. I'm going to be 50 this year, and I've been in this field now for over 20 years, waiting for the Holy Grail to come out. So I'm an animal advocate. I love that idea. And at the same time, research is moving in a way that if we're able to get those organs, there are so many people, especially young kids, who just suffer through dialysis, where this is something that needs to be considered, and if it's possible, it needs to be done. But it should only be done in as humane a way as possible.
Yeah. Okay. David said, how can I get iodine when following a plant-based diet? Um, well, I mean, the two biggest sources is your seaweed, dried or fresh seaweed. That's going to be the biggest sources of iodine, and obviously iodized salt. And we talk about low sodium diets. I would say from a standpoint of iodized salt, that's why all salt, whether it's Himalayan pink salt, whatever iodized salt, it's all going to contain sodium. But that's where the benefit of cooking your meals at home and you use a little bit of salt and still be low sodium, then you can use an iodized salt. Again, seaweed, there's some like fruits and veggies and beans that will have a little, be a source of it as well. But then there's also some people may need to consider having it as part of their like vitamin or supplement too. Anything you want to add to that, Dr. Hashmi?
Mm-mm.
Okay. Someone said my creatinine and GFR are excellent, but they checked their cystatin C for the first time and the value wasn't good. How can it be? Which one should they consider more? And is it something to worry about? So normal
No.
creatinine,
Yeah.
lower cystatin C.
No, remember, cystatin C is just another way. It's got its limitations based on all sorts of variables. And this is where sometimes, a little bit of information will scare the heck out of us. If your number, whether it's done through EGFR or it's done through cystatin C, is staying the same, you don't have protein in the urine, your weight is okay, your blood pressure is okay, don't worry about it. Life is too short to begin with, and we got so much other stuff to deal with that worrying will not change a thing. You're looking for stability. So if you're going to rely on cystatin C, then stick to cystatin C. But we use EGFR predominantly. That's the one that's used in most places. So stick to it, and I wouldn't worry too much about it.
All right. Vincent said, good news from a nephrologist. He said everything came back good or normal. And he said there was signs of protein in the urine, but they're eating more plant-based food and that might be helping. Definitely. Keep that up, Vincent. Okay. Jill said, I've been whole food plant-based, no oil for a little over a year. When they started, their GFR was 46. It increased to 66, but their most recent lab, it dropped to 60. Should they worry?
No. Because when you repeat a blood test, if you repeat the same blood test 3 times in one day, you will get 3 different values. And those values can be off by anywhere between 10 to 20%. So we don't make a big deal out of it. The first thing we do is if we see a trend, that's where we want to do something. So in other words, there's 3 data points that are showing a consistent decline. That's where we want to do something different. But otherwise, no, we don't make a big deal out of it.
Yeah. All right. Someone with stage 5 kidney disease, how much active and inactive vitamin D would you recommend?
Oh, that's an impossible question to answer because we have to base it on your blood test. Right? This is where individualization is so important, simply because if you just randomly take vitamin D increases the absorption of calcium. And if you're getting too much calcium and you have significant kidney disease, it can go and deposit inside your blood vessels. And now you're calcifying your kidneys, your blood vessels, and so forth. Versus if your vitamin D levels are already very low, that's going to convert into less active form of vitamin D. That's going to stimulate the parathyroid. That's going to cause you to have renal osteodystrophy. So we need to fix all of those. So in other words, that kind of stuff, you gotta see where your blood test shows the inactive or the regular 25 hydroxy vitamin D level is, and then your provider can guide you in terms of the information around it.
Yeah. Okay. Going through these. Let's see. What can a 26-year-old male who recently found out he has one kidney and is in stage 2, what can they do to prevent further progression of the disease?
So what's fascinating is people donate their kidneys, and these, in my opinion, are some of the greatest heroes. And I've seen people donate their kidneys to strangers, and after that, you will see that the kidney number is a little bit less. But here's the thing: the one kidney you do have can take over the entire function of the other kidney, and it does that, and you don't have to worry about it. But the most important thing is everything that Michelle and I have been talking about. And Michelle, I can't remember how many episodes we've done. I know it's like uh, way over a
For
hundred.
100.
Right. But in other words, everything that we've said really starts with lifestyle. And you got to put the life in this. So, in other words, are you stressing? Are you eating? Are you moving? Are you sleeping? Work on those things. Those are just the basics. And as old as those basics are, they're still the most effective thing. Now, they don't sound sexy. There's not a lot of style to that portion. I get it. But it's the tried and true. It's kind of like all the wisdom my parents gave me. And I was like, you don't know what you're talking about. Now, I have kids and I literally tell them exactly the same thing my parents told me. How crazy is that?
All right. How can someone reduce PTH? This is someone from Canada. So we have more countries. Hello.
Yeah, so welcome from Canada. So remember, parathyroid gland is also dependent on a number of things, right? The main one that we're talking about repeatedly today is the role of vitamin D. So vitamin D can feed over there and help you to do that. The other part of it is your blood calcium levels will affect it. So if the calcium is low, the parathyroid will say, hey, to the bones, hey, I need you guys to break down and release more calcium. So PTH will cause that. So maintaining adequate calcium levels matters. This is why when sometimes people have disorders where they're spilling too much calcium, their PTH will rise not because of kidney disease, but because of too much calcium or calciuria. Urea meaning it's going in the urine. So that's it. We fix your vitamin D levels and your PTHs will calm down. Adequate calcium, adequate vitamin D, and they'll fix it. If it's primary hyperparathyroid, which means the glands are overactive, then sometimes we also need to talk about surgery. If it's secondary and it's not responding to the stuff we're doing, then sometimes we need to do surgery.
Yeah. All right. Well, unfortunately, somehow it's already 5:30, and I know we gotta cut it to 30 minutes this time. Usually we do an hour, so we should be back to an hour episode live Q&A for April, third Tuesday of every month, 5 p.m. Pacific time, 8 o'clock Eastern time. There's a lot more questions in the chat, so sorry you couldn't get to everything, but join us um, next month, and then obviously check out our page and all of our different playlists and episodes because we address a lot of the same topics a lot, like diet and protein in the urine and lowering creatinine, and those come up all the time. And we have lots of episodes on those. So please check those out. And thank you, Dr. Hashmi. We appreciate and we value you coming on here and answering all these questions.
Thank you, guys. Take care, everyone.
See you next month.
Bye.